are some market forces, but it's all screwed up because insurance companies act as cartels, and this is because of government regulation. You can't sell insurance across state lines. Certain people get carve-outs. The whole idea that health insurance is treated differently as a form of compensation than cash is one of the original sins of this whole situation. We should not be treating health insurance if your employer says, you know what, here's $15,000 in health insurance, it doesn't get added to your tax bill. That's a problem. We should all be paid what our employer wants to pay us, and then we should be free to buy health care or not with that money. I think, again, this goes to the question of price transparency. Right. As Sally was saying, nobody knows what anything costs. As a patient, I don't know what it costs. I've gotten bills recently. I moved here a year ago. I went to a doctor, and I ended up getting my insurance company, said, this seemed to be too much, and it was an office checkup, and it was like $600. I had no idea. I paid $35. Something is screwy here.
Adam.
Well, one cost we do know is that the U.S. healthcare system is twice as expensive as the healthcare systems of other high-income nations. So despite that lack of transparency, we're spending a lot more. The fact is that healthcare cannot be treated as another market good. Why? Why is that? Because in a market system, those who can afford healthcare get it, those who cannot afford it don't, and suffer. And that is what we have in the United States. We already have the most market-driven system compared to these other systems. I think you'd agree. And as a consequence, we have tens of thousands of people dying a year because of lack of access to healthcare. One final point. The idea that why can't healthcare just be like, beer or cars or luxury TVs, there's one good reason why we can actually eliminate copays and deductibles for healthcare and not have this explosion in healthcare demand. It's because people don't want to take drugs they don't need. They don't want surgical procedures they don't have to have. They don't want brain biopsies. They don't want to be in the hospital more than they have to. So there is a self-limited demand. You can, in fact, eliminate copays and deductibles, and people will get the care they need when they need it.